Good morning and welcome back to Margin. This morning, we're going to talk about whether your healthcare is draining your bank account. So let's jump right into it. So this goes without saying, but having a baseline health insurance policy is a necessity to protect yourself against potential healthcare related expenses. So oftentimes there are so many different schools of thought around the extent to which you should utilize Western medicine, which is your healthcare company, your healthcare providers, versus homeopathic approaches to caring for your health and your overall well-being. Now, without going into that whole argument, you may be thinking about all the ways that you care for yourself, including chiropractic adjustments, maybe massages or yoga or acupuncture, amongst a number of different methods otherwise. So whether your approach is to take more of a Western, health approach of treating the symptoms, or a homeopathic approach of treating the actual root of the cause of whatever you're dealing with, it's important for you to think about what you're actually spending related to your overall health, the overall care for your health and well-being. So it can be easy to justify not spending your resources on your health, being that it is more of a lag indicator per se, meaning that you don't typically see the results of your eating habits, maybe your lack of exercise, or the management of your stress immediately. They lag behind the behaviors you have in place, or the mechanisms you have in place, the practices you have in place. And so you don't necessarily get an immediate response to your lack of intentionality in those areas. So unfortunately, medical debt is the leading cause of bankruptcies today. So this lag indicator can actually catch up with you very quickly in the event that you don't make a priority to have health insurance in place, to have those checkups done, to make sure that you are proactive in maintaining and taking care of your health. So if you have a W-2 job, you may have a group benefits plan provided by your employer. Now, these plans continue to cost employers more and more, which typically translates directly to a lower and lower percentage of the benefit being covered by that employer, which of course that means that you are paying more of that bill each year as those costs increase. So it's important to look first at what benefits are provided by reviewing the plan documents of what coverages you have and maybe the deductibles that are available to you under that specific plan. So typically, hand in hand with your healthcare benefits, you will opt in for dental and vision coverage as well. Now, you may opt out for vision coverage depending on the health of your eyes and your overall vision, but dental is usually an important addition to your healthcare benefits. Now, properly caring for yourself means that you are making a priority of your health. So if you are self-employed, you may not actually have benefits readily available to you. So it's important to explore a private policy or a co-op in order to ensure that the basic healthcare coverages are in place to protect you. So beyond the out-of-pocket deductibles, the co-pays, and maybe even the cost of prescriptions, it's important to figure out a game plan for your health so that you can actually budget for the expenses related to your health accordingly. So this means that you're not just looking at your health insurance and the premium that's coming out of your paycheck each month, as well as dental and vision, but also looking at the costs associated to any other aspects of care that you would need to be factored into this. So for example, if you regularly attend a gym, or you get a massage, or some other component that maintains your health, these components should be included in your budget or your plan to spend on a monthly basis. So this ensures that the components of your health are reflected in the priority you give them within your budget. So if you do feel like this area of care is especially expensive, I would say it's because it is. It's really expensive, and the costs continue to rise, year after year. And as healthcare continues to rise in cost, it's so important to be reviewing the provisions of that plan, the plan that you have in place, to see what may already be included in your health coverage without you actually even noticing it or knowing it. So for example, something like periodic acupuncture, a gym membership, or some other type of benefit like health screenings may actually be included in your policy and may not cost you anything additionally if you use in-network options that are provided by your healthcare provider. Now, we have all met people who have not properly cared for themselves. They have not gone through the process of being proactive, and rather they let those lag indicators tell a story, but not allow the story to change their habits and behaviors. So making the decision to be actively involved in the care needs you have related to your healthcare will prevent you being like that. Will prevent you being reactive instead of proactive with your health. Now, my call to action today is to seriously look at your health insurance policies, reviewing what is actually included in these policies and factoring in those aspects that may not be included, which contribute to your overall health and well-being, but need to actually be factored into your budget. If this information is helpful to you, please do like, subscribe, and hit the notification bell so you're reminded to come back on a daily basis and improve in managing your personal finances. Thank you for your time. Enjoy your day, and we'll see you back here tomorrow.